According to the latest report from the CDC, at least 15 states in the country experiencing high or very high levels of respiratory illness. The 3 Siouxland states currently categorized as low levels of respiratory illness activity. However, health departments in Siouxland are seeing a rise now in sick patient numbers. And it's our top story at 10. The CDC is actively tracking a rising COVID variant known as JN1, but that's just one of many respiratory illnesses seeing an uptick nationwide. The former emergency response coordinator for Dakota County Health says RSV and the flu are also on the rise, but her office is noticing more people requesting COVID tests.
We have seen a lot in this last week, last 7 to 10 days. There's been a much more of a need for the tests and the request for them. I would say on average we've been getting 2 to 3 calls a day requesting for multiple tests because they want to pick them up for their family and they want to pick them up for their friends.
The CDC estimates there have been at least 2.6 million illnesses, 26,000 hospitalizations, and 1,600 deaths from the flu so far this season nationally. The rise in COVID-19 cases in Siouxland has been significant enough that Dakota County Health is now awaiting help from the state of Nebraska.
We were hoping that we're wrapping up the at-home COVID test requests, and now, when this last week they've started to, be asked for a lot more. And we did get a notification from the state we will be receiving a few more in the next week or so. So we will have some to hand out for people who are in need.
The CDC's latest guidelines, if you test positive for COVID-19, are to stay home for at least 5 days and isolate from others in your home. Health officials we spoke with today also say they understand the holidays are here and it's difficult to not gather, but that you should at least be washing your hands regularly and avoid touching your face often.